Welcome to the Village Vision podcast, where community, collaboration, and care converge. I'm Dr. Crystal Morrison, and I'm honored to be your host on this incredible journey. As a firm believer in the power of a united village, I'm thrilled to bring you inspiring stories, research, and projects that break down barriers in child and family care. Through heartfelt conversations with experts, advocates, and those with lived experiences, we'll showcase the transformative impact of collective support. So join me on the Village Vision podcast as we explore the remarkable collaborations that lead to better outcomes, foster a sense of community, and inspire action to improve care for ourselves and everyone around us. Dr. Tiffany Gary-Webb is the Associate Dean for Diversity, Equity, and Inclusion and a tenured professor in the Department of Epidemiology at the University of Pittsburgh School of Public Health. She's an accomplished researcher, having co-authored or authored over 140 scientific publications, including journal articles, book chapters, and editorials. Her current research agenda is the culmination of over 20 years of experience working to understand the social and environmental determinants of chronic diseases and implementing interventions to improve prevention and control. Welcome, Dr. Gary-Webb.
Thank you. Thank you for having me.
You're welcome. So when it comes to your work, there are so many different angles that we could discuss because, quite frankly, all of your work is at the intersection of community, collaboration, and care.
Doing applied research, making sure that the research that we do at the university gets out there. So that's been kind of the theme of my whole career. But the work with the Black Equity Coalition has just taken that to another level because of the urgency and the devastating consequences of COVID-19. Particularly for Black populations, which we do focus on, everything that we did had much more impact. We had, more collaboration, more multidisciplinary collaboration. And I say, we say that we have a data to action approach, which means that the things that we were doing were having really real-time impact in the community. And so that's why it was really different, because it wasn't, I published something and then somebody does picks it up and, or gets in a systematic review.
And so, having been in academia myself, we're always very hopeful that our work has the impact that we want it to. And you were literally sitting at that intersection again, where your work was directly impacting the community and the work of a lot of others, because what was so important is that you were bringing a lot of people together.
Absolutely. And we do have a publication that talks a little bit about kind of our origin, but groups around Pittsburgh existed and certain pivotal things happened. So for example, 2019, the Gender Equity Report came out and talked about poor health outcomes, particularly for Black women. So there was mobilization around that. There was the creation of Equitable and Just Greater Pittsburgh. So there were groups that were working on these issues. But when COVID hit, we were seeing news and media reports from around the country that were really showing that Black populations were hit harder. So all these things were happening. And then there were some of us that were in multiple spaces. And we ended up forming this coalition. And so where we became very strong was in our data working group. We're now called the Data Justice Working Group, because we were not only just pushing the health department and the PA state health department to really release this data, but we were also helping them, figure out some of the kinks, because one of the reasons why they didn't want to release it is because there was a lot of missing data. There were a lot of gaps, like just for example, if you go in for testing, the screening, which asked you about race, sometimes that wasn't even happening. So there was not even a way to know, who was getting tested and so forth.
You and I both. Here's the thing, though, is COVID blew up and exposed inequities that have existed for generations, right? And COVID really put that front and center.
Yeah.
And I think it's good to really, I'd really like for you to share a little bit more about the specifics of what those inequities looked like for Black people, not only here in Pittsburgh, but across the country, number one. But number two, thinking really long and hard about vaccine hesitancy in the Black population because of a very long history of issues with the healthcare system. So, one of the things that I found really interesting and exciting about that time was there were people who were going into the communities that could really speak to that hesitancy. It took a little while, but there was recognition among certain groups of people that you just can't, have a free vaccine in a free vaccine center. You need to be talking to people and understanding the reasons behind their hesitancy, which is very real and valid.
Yeah.
I'm assuming that the coalition was part of some of that education and work as well.
Yeah, absolutely. And
wonderful. The Black Equity Coalition is such a great example of the collaboration that can happen between these different organizations that are traditionally very siloed. So political leaders and community leaders and academia and healthcare. And so it's such a great example of really working at that intersection. It's really important, those, listeners, it's really important that you understand that this is not just a Pittsburgh challenge. This is a challenge across our community and our world, quite frankly. And so the Black Equity Coalition is a really good model that can be duplicated, in my opinion, and really used to leverage and promote better understanding, number one, but also action, number two. So it's just really, really great example. So Dr. Gary-Webb, thank you so much for joining us today on the Village Vision podcast. I'm super grateful that you shared your story, but also your experience and the work that you're doing with our listeners.
Thank you so much for having me. I enjoyed talking with you, and I'm always happy to be able to share what we do.
Wonderful. Well, thank you for joining us on this episode of the Village Vision podcast. I hope you found inspiration and valuable insights from our conversation today. If you've enjoyed today's episode, please subscribe, rate, leave a review, and share. But thank you. Thank you for being a part of the Village Vision podcast on Word of Mom Radio. Take care, and let's keep shining a light on the power of community collaboration and care.